Men that have low testosterone, especially symptomatic men, have options other than taking testosterone. So what do men do if they don't want to take androgel, creams, shots, and put up with some of those side effects? Early in my career in the 1990s, I was basically an infertility physician. So I worked with couples that were having trouble getting pregnant. And one of the things that we dealt with were men that had lower sperm counts and low testosterone that was symptomatic. So we could treat them with testosterone. And we also treated them with Enclomiphene citrate, which really isn't that good at getting sperm counts up, but there's an alternative that actually works. Enclomiphene is a selective estrogen receptor modulator, but it has both an agonist, meaning it improves, and an estrogen blockade type of mechanism of action. But its sister drug, called Enclomiphene citrate, is specifically an estrogen blocker and helps through natural physiology for men to improve their sperm counts as well as their testosterone levels. Digging back 20 years, I found data on Enclomiphene citrate that puts it on the par with androgel. So in 2004, a study from Fertility and Sterility, just in 2 weeks, compared Enclomiphene with androgel, and they were neck and neck. The Enclomiphene dose that matched androgel was 50 milligrams a day, and it raised total testosterone level to just under 600. And it does all that without the side effects. So no shrinkage of the testicles, no increase in estrogen and breast symptoms, no real significant conversion to dihydrotestosterone, the kind of nasty one. And from a PubMed review, really no significant side effects. It is an estrogen blocker, so maybe some hot flashes at the 50 milligram dose, but they studied 12.5, 25, and 50 milligrams. One study showed 25 milligrams was kind of the maximum response for testosterone production and sperm production. If you're wondering about your testosterone level and your doctor won't run the test, get it yourself. Right now is a good time because Life Extension has their spring sale where you can get a male basic hormone panel for $56.25. They'll mail you a kit. You have to find someone to draw your blood and centrifuge it, mail it back, and 7 days later, you'll have your results. Email me and I'll send you the link on how to do that. So those of you out there that wonder about your testosterone, you can check with an androgen deficiency in the aging male scoring system from St. Louis University. If you meet the criteria, you have a suboptimal testosterone level. You have to find a doctor that buys into that because most of the time they're going to tell you your level's normal. Under 600 is a problem, especially if you're under the age of 60. So worth bringing up, Enclomiphene citrate at 25 or 50 milligrams a day seems to be a very safe way of increasing production of testosterone naturally, using your own physiology. Have a great day. I'll talk to you later. Bye.